All right, Chris, thank you. 8:20 right now. It is National Dental Month, and just like humans, it's important to make sure our furry friends have healthy teeth and gums as well. Here with some tips is Dr. Bill Lewis from Lincoln Highway Vet Clinic in Lancaster. Good morning.
Good morning.
Thanks for joining us. Always a big topic for all of us animal lovers.
Yes, definitely.
Tell us what qualifies as dental disease. When do we know we have an issue?
Well, to start with, it usually will be the plaque and the tartar accumulation, which is the bacteria, and then the hard debris that accumulates on the teeth. From there, it develops into gingivitis, which is inflammation of the gums. That can cause, of course, bleeding and other issues. From there, we start getting into the beginnings of periodontal disease, where the gums recede. We start getting the breakdown of the tooth supportive structures. Bone recession occurs. We can get into infections within the bone. That's when we start getting into loose teeth and all kinds of problems.
Yeah, how do you catch this beforehand?
You look at a couple of things. Number one, if you start noticing reluctance to eat food, especially hard food, we'll find that they won't want to eat the hard, but they'll eat more of the wet food. Of course, bad breath is one of the first odors that we'll see. The animals might get food in their mouth and then they just let it drop out. Bad breath is usually the first thing we'll generally notice.
And bad breath, is there a difference between, oh, they ate something in the backyard?
Yeah,
that's what happens to our dog.
Exactly.
And really bad breath.
There generally is, because when we start thinking in terms of something that they ate outside, you're going to have more. It's going to be more of a distinct kind of odor related to that versus more of a pungent odor that you're going to get with dental disease, odor that can practically knock you down, so to speak.
What kind of things can be done, procedures can be done to prevent this or to solve it if they get that far?
Oh, sure. Definitely the preventative standpoint, as puppies start brushing their teeth.
Okay.
That's generally...
It's so hard to do.
Oh, I know, and we generally don't think about it because as puppies, they lose their puppy teeth, so we don't think about it. But that's when to get them started so that when they are adults, we can do a little bit better job. Of course, any of your dental treats are fine, your greenies, and there's some of the dental sticks. The drawback of those is they're going to keep the back molars cleaner. They're not going to do much for the front teeth, and that can be some issues. And then there are some dental cleaners. There are some solutions to put in the drinking water, especially for cats, to help disinfect the mouth, keep the bacterial population down. We're showing some images of kind of pre and post dental cleanings, and you can see where you can have some really bad teeth, a lot of tartar and plaque on, and then you can see where it's a little bit more red around the gums. And there we've got the tartar and the plaque developed on the teeth. Cleaning is generally what we think about what's called a dental prophy, and that includes an ultrasonic scaling of all the tartar that's on the teeth, getting all the debris off of it, going up underneath the gum line to get all debris off of there. We then polish the teeth to try to give it a smoother surface so that we don't have as much of the plaque or the tartar accumulating on it. And then oftentimes we end up having to pull teeth if they're that bad.
Wow. I could go on about this forever. I have so many questions, but we're running out of time. Tell folks where you guys are located.
It's Lincoln Highway Veterinary Clinic. We're located on the east end of Lancaster.
All right, and we'll have more information about where folks can find you and talk to you on our website, fox43.com, 824. We'll be right back.